But today we have a guest with us who's actually speaking to us remotely from, I believe, one of the Carolinas, somewhere over that way, and that's John Correia. John Correia, I've known for 15 plus years as a friend. However, his career path has taken him an interesting route, starting off in the Navy, then becoming a pastor for many years, and then starting a website called Active Self Protection, where he basically narrates personal protection and self-defense scenarios, videos that are sent to him through different means, and really translate it to the layman to understand what's going on and not going on. And he's been incredibly successful in this. He's an expert witness for courts. He's been called for all over the nation and even the world to get his input. But today we're going to talk about him as a human being a little bit and have you guys discuss some of the topics. Because John, thank you for joining us. You have had some interesting things with your family when it comes to mental health, transgenderism, and combining that with your faith as a pastor. Can you chat a little bit about that?
Yeah, it's been, an interesting ride. Yeah, so if people know me, they know me from probably our YouTube channels. But obviously, I'm the husband to one. My wife and I have been married 26 years in about a week and a half. And we have four kids, 24, 22, 19, and 15 now. And mental health care issues run through our family pretty significantly. My wife has struggled with depression for, most of her life. My four kids have all, at one time or another, made inpatient mental health trips for acute depression and anxiety and various other things. My oldest identifies as transgender and is transgender. I would say how would she identify today? I think gender fluid, but that changes, sometimes. So I couldn't give you a definitive answer there. And so, my kids have been through the ringer, and I'm a follower of Jesus. And so that's the most important thing to me, is that he's happy with me and what we do. And so all the real challenges my kids face started when I was pastoring a local church. It's an evangelical church in Glendale. Did that for 15 years, and my kids' real struggle started while I was doing that. I've transitioned out of vocational ministry. I didn't leave the faith. I just quit a job and into doing active self-protection full-time. And so, my wife and I love our children, and we want their best. And learning to navigate those waters has been rough. I spent a lot of nights, crying into my pillow, wondering how we were going to make it. We've definitely had time where, I've looked at my wife and said, there's a good chance we're going to bury this kid this week. So let's not remove ourselves from the fact that we might have to plan a funeral here. And having to come to grips with that's a big deal.
Yeah,
let me ask you a quick question. How do you manage the uncertainty of not knowing? And I'm asking you this because this is what I do for a living every day, and the uncertainty of not knowing if your child's going to be safe. What gave you the strength to navigate those waters?
I really think in my case and in my wife's case, it brought us to our knees before God to say, okay, Lord, they're not mine. I'm not, even as a teenager, I can't guarantee their safety. I can't guarantee their tomorrows, but none of us are guaranteed tomorrow. So all I can do is trust Jesus enough to do the next right thing. I have a mantra that I live by, and that is that there is no hope for a better past. That I can lament the situation I'm in. I can say I don't like the situation I'm in. I can say I wish it wasn't so, but I can't change it. I can't say, there's nothing I can do but radically accept reality. And if there is no hope for a better past, this is where we are. What step can we take to just put ourselves in the best position? And then recognize that ultimately the outcome's out of my hands. And that's hard. A lot of days, like I say, I spent a lot of time on my knees. I spent a lot of time in prayer, a lot of time crying, a lot of time worried. I will say I never was a person of anxiety until my kids really started struggling. And then I caught myself and still, will sometimes have some anxiety challenges. And those are manageable, and you learn how to manage anxiety, and you learn how to go, okay, wait a minute, I can cope. But I think at the end of the day, Dr. Patino was mostly faith in Christ, and that He's in charge, and that nothing comes into my life that hasn't passed through His hands.
Okay. So life has given you lots of training, let's say, in terms of how to handle uncertainty, in terms of how to handle pain. And you learn that you survived it, right? I mean, at the end of the day, we'll end up being survivors in one way or another. How did that make you a better trainer in terms of self-defense?
Well, I think, some people like that mantra of that which doesn't kill me makes me stronger. I kind of prefer to say, listen, what else does it take but the Lord for me to be okay? Am I okay? Will I live through this? Am I going to be okay? If the worst happens here, will I make it? And I think that's a big and important thing, and I look at that in my worldview as a follower of Jesus, that me plus Jesus plus nothing means I'm okay. I'll make it. We can make it and I'll be okay. So then I think in our message of self-defense, that's kind of what I call emotional fitness. That says, am I okay? Can I make it? Can I continue to function? And in self-defense, we talk about if somebody's attacking you or hurting you or wants to hurt you, you have agency still. You still have decisions to make. As long as I have consciousness, as long as I have ability, then I have agency. And so if I give up my agency, then I give up my power. And instead, embrace your agency, embrace the ability that you have to make a good decision and take a step to make yourself safer.
Okay. From that perspective, and you start looking at teenagers, for example, you usually have a 15-year-old kid. I have an 18-year-old daughter and two 30-year-olds. I find that with the newer generations, we're finding kind of a high degree of emotional immaturity with a high degree of intellectual maturity. So it's like kids nowadays want to think as adults, but then they behave like a 3-year-old, right? They throw you a big tantrum.
Right.
And that's adolescence in general. But I find that kids nowadays are less capable of recognizing danger, right? I don't know if you have noticed that. Do you think that that's in part because of their overprotection to some degree?
Yeah, I think, I do think that what we're seeing now, so first of all, I think kids in this generation have pressure and have inputs that I never had. I mean, I'm a Gen Xer, and I grew up with an analog childhood. And so I just tell people all the time, I thank God I wasn't a teenager during the years of social media. Because the pressure that puts on you and that expectation level of perfection, whether that's perfection physically, it used to be when we were kids, girls would get Cosmo, and that would give them pictures once a month. And now they go on Instagram and they get 50 of them refreshed to them moment by moment.
Exactly.
Of the ways that they fail, and the anxieties that brings, I think, is significant. And then I think that they also struggle with that because they have the world of information at their fingertips. And so intellectually they grow very quickly, but emotional maturity, Doctor, you're the one to talk about this, not me, but the frontal lobes of the brain don't develop until you're 25, for gracious sakes. And so, there's a reason you can't rent a car until you're 25. And as a man, especially, you're going to make stupid decisions. Hold my beer and watch this. And I think these kids, they get so far ahead of the game intellectually, and it's hard for them to cope with that emotionally, particularly given the pressures that they're under.
So one of the aspects of faith that I find fascinating has to do with how it allows you to tolerate uncertainty, right? Because at the end of the day, life is uncertain. I mean, if there's one certain thing about life, is uncertainty.
Amen.
So how is it that kids get to learn to tolerate uncertainty nowadays when they're bombarded with all of this stuff? It's like there's no time for reflection, right? There's no time for listening, understanding. It's just from one picture to the next.
Yeah, and I think that, I do lament even teenagers today not being given much time to play. I think that kids from a very young age, there's this trope of of kids getting into the right preschool so that they can have the right college experience and have the right career and be successful. And I go, my God, I was eating paste in preschool.
Mm-hmm.
And we never thought about that stuff. And my wife and I were in the Midwest right now, and we were driving through a little town in Iowa, and we see a couple kids just out riding their bikes in this little town. And I rejoiced. I was like, look, it's just kids out riding their bikes, man. Just out exploring the world and having time to reflect on it. What a cool thing. So I do think generally that I see kids struggle with that. Every moment has to be filled with productivity. Every moment has to be filled with meaning. If I'm not doing schoolwork, then I'm learning the violin, or I'm playing on a sports team. I'm highly overprogrammed and overpressured. So it doesn't give them any time to reflect and just be kids. And I kind of wish they'd have more of that.
Yeah, and talking to Vince in one of the programs recently, we were talking about the ability of kids to take risks, right? I mean,
Yeah.
growing up in an open environment, riding a bicycle in an open field, you know, with a couple of friends, that exposes you to risk, right? But you learn by being exposed to the risk, how do you go about dealing with this? And that's one of the challenges that I have with parents nowadays, in particular, how to help them understand that putting kids in boxes from one box to the next doesn't necessarily helps the kid recognize danger or risk. Do you think that we have oversell the idea to parents that the world is too dangerous for their kids?
Well, you know, statistically speaking, the world is so much safer now than it's ever been for children.
Mm-hmm.
And so there's a huge perception reality gap for
Mm-hmm.
parents. I mean, your risk right now for your children of stranger abduction is historically low. And yet so many parents say, well, I wouldn't let my kids go ride their bikes in the street. They might get kidnapped. And that is not unheard of, but it's so radically rare.
Mm-hmm.
And I think that as a parent, sometimes our 24-hour news cycle, our social media exposure, I mean, 50 years ago, you never would have heard about a child being abducted 1,000 miles away. You know, if you live here in South Dakota and a child gets abducted in Phoenix, Arizona, you'd never hear about it. But today it'll make the social media rounds, and you will. And then that gives you a skewed perception of reality. And so I think sometimes as parents, our skewed perceptions, I know I've been guilty of this, that I put my skewed perceptions on my children in terms of what I'm willing to tolerate to their detriment.
Okay. What do you think, Vince?
You know, it's interesting you said that. I think you're right. They have to have a certain amount of risk. I think there's a lack of reality. John mentioned it. We are living in historically the least violent time of our planet. Individually, we really don't have a lot of these personal risks, but there's a perception of it. And I always use the analogy when I teach what I teach is that when we go to the beach, everyone is focused on the shark, right? Because that's the most
Right.
horrible thing that could possibly happen to you. But statistically speaking, it's the least probable thing. And instead of focusing,
you're more likely to be killed by a cow in America than a shark.
Absolutely, exactly, right.
It's true. That's actually statistically true.
So,
Yeah.
I mean, other than when they're driving, the first 5 years of learning to drive, when they are statistically in an incredibly risky time where they could be in a combat zone and safer, really most of our kids live in a world that is significantly safer than it used to be. And I think maybe some of the issues that you're discussing is really, again, the parents. The parents are so focused on that shark that they're not teaching their kids how to swim. They're not letting them swim. They're not letting them take the more common and more probable, more consistent, smaller level risk, because they're so frightened about that large risk, that terminal risk. And I know, John, we deal with this every day in our worlds, because I kind of have a foot in both worlds, Dr. Patino's and yours, about personal protection. If people come to you and are truly delusional about the risk to themselves personally, and I think that's something that has to be managed. Education, the child wants to take those risks. The parents have to be willing to allow it.
We joke about, mom versus dad, right? That mom's hovering. Dad's like, well, if you fall out of that tree, it's a lesson you'll learn. You break your arm and you'll be all right. Mom's like, oh, yeah, how could you allow that? Well, I mean, we learn by risk. We learn by consequence.
You see, I grew up probably 10 years before you guys. I'm a Gen X. I'm a baby boomer actually from the last wave, and one of the things that I found different now, and I'm guilty of having restrained my kids from that too, is that there was a sense of community helping raise the kids. No fences, everybody playing in the backyards, people playing on the streets, all of the parents kind of keeping an eye on the kids. I don't see very much of that in large cities. I think that there's something to be said about places like Iowa, in the Midwest, rural areas where that still happens a lot.
Yeah,
But
I agree.
yeah, I don't see it happening a lot in the big cities though.
I see, in suburban areas. I live in the burbs. I live in
Mm.
Phoenix, and much more structured environments. Kids are going to interact in baseball camp, or on a club soccer team, or a school extracurricular activity, or quite frankly, in my world, sometimes it's group therapy, or jujitsu mats, or something like that. So it's a much more structured environment where generally they're kind of told, no, sit and learn from an adult and practice in a very structured environment. So I do think giving them some unstructured time that is just go and explore and experience that can be very valuable.
Absolutely.
But doesn't the internet and access to all that information give them a way to explore in a different way? I know my step kid, some of the issues that a lot of kids have had in the past about genders and race and things like that, to her are non-issues. It is a non-issue because they've been communicating with those kinds of people, even if their parents and their grandparents don't want them to, in a different modality than we did before. It's not necessarily face to face. Let's go to the park. It's a way of communicating, and I know there's challenges to that, but I think there's also some liberating factors.
I totally agree with that. I can tell you that my kids, when they were really struggling, they were able to find community, other kids like them, other kids that struggle the same way they did. Now, for good or for ill, right? Sometimes you can perpetuate problems in those that they normalize those problems. But on the other hand, they can find support and encouragement and normalcy there in a way that we just couldn't. That you might be the only kid like that in your geographical neighborhood, but you're not the only kid like that in your online community. So I think it can be very helpful from that perspective. I think obviously having all the world's knowledge at our fingertips hasn't solved the world's problems for sure.
Just
Yeah,
created new ones.
yeah, and well, I think you're absolutely right. But there's also something to be said about the need for uh, recognition of purpose, right? I mean, what are what are we doing this for? What is the purpose of what we do? Where are we going with? What is the purpose of parenting and all that stuff? And we have to remember that, especially with teenagers, adolescence has a purpose, and the purpose is separation, right? So we have to recognize and be somewhat more accepting of the fact that our kids are going to have certain attitudes that are going to be rejecting of authority. And I always like to say, I mean, most of the problems that we deal with in the mental health side have to do with intensity and frequency, right? But I'm seeing a problem now with overreacting to one event, right? If a kid has a crisis, then it becomes a mental health problem. And it's not necessarily a mental health problem. It could be a communication problem. It could be a number of different things. I mean, obviously, you, John, have seen the frequency and intensity over time that leads to potential danger, right, with your kids. But that's the exception. That is not the rule. But I have to tell you, nowadays, I'm seeing a lot of kids who end up being hospitalized because they had one event, no history, no intensity, no frequency, almost to the point that parents are scared of their kids, right? It's like they're scared of the kids' frustration, they're scared of the kids' anger. And that's where the love that we were talking about before is that we have to understand that when we're raising kids, it's not about us. It's not about us parents. It's about them kids, right? For good or
Well,
for bad, we've done it.
I think one of the things that as our kids struggled that my wife and I really had to do. My wife is an incredible advocate for my children and I mean just otherworldly advocate. And I think that a lot of parents they go, I don't know what to do here. And so I'm going to bring my child to the expert. And that's what they do in everything. I'm going to bring my child to the teacher because they teach and I don't. I'm going to bring my child to the youth pastor because they pastor and I don't. I'm going to bring my child to the coach because they teach and I don't. And now I'm going to bring my child to the doctor because the doctor heals and I don't. Whereas my wife and I took the approach that said, listen, you're the expert in your field. I'm the expert on this child. I know this child better than anybody else. I know what they're doing, what I'm seeing. And so that to us gave my wife and I advocacy to say, listen, I get it that you see a lot of kids, but we're the expert in this child. And so I want to trust you with what you see and what we're telling you. You need to trust me with what I see and how I'm processing this. And I get it. A lot of those folks, they deal with dysfunctional families quite a bit. And they deal with dysfunctional parents quite a bit who manipulate and lie or try to hide and save face and those kinds of things. But we just took that advocacy that said, no, we're an expert in this child. And so we need help. We need guidance. We need some assistance here. But we're going to advocate for this kiddo and come what may. Now, I'll tell you, come what may was a couple of DCS investigations over the course of a few years as we disagreed with healthcare providers.
Yes.
but I think it was worthwhile.
Absolutely. And I have to tell you, I like what you said, because I hope that I see more of that, right? Because I don't perceive my job as a psychiatrist and an expert in mental health issues as a dictator, right? It's not my job to tell people this is what you have and this is what you have to do. My job is to analyze situations and present them with options, right? This is what I see, especially with kids, is never written in stone, right? I mean, and I deal with my students all the time with this. They want to have a diagnosis. And well,
they need a label. They want a label.
Don't go into the label. Get into understanding the behavior of the child and give the parents and the child options that they can exercise. And I had to be part of my head on the legal forensic side. Whenever I had to go in court to defend the doctor, the number one reason, right, that the doctor got in trouble is because didn't give the patients options and they got dictatorial, right? It's not our job to tell people what to do. It's our job to provide them with understanding, scientific, social, cultural, and give them options, right? What option do you want?
We call that informed consent.
Yes.
So my wife is a home birth midwife, and informed consent is humongous to her. And I think that we don't see that a lot. We don't see a lot of, and I think some of that is on the healthcare providers to say, no, you're in charge of you, and I'm here to educate, provide options, and open doors for you. So, and this is what I love about evidence-based medicine. We use evidence-based defensive training in our principles. And, obviously, this far better than I do, Doc, but when you say, what does the best research say are effective outcomes combined with the experience of the practitioner, combined with the values and background and choice of the patient. And when I put all three of those together, I have evidence-based medicine. And we do the same in self-defense, and that requires informed consent. And empowering the patient and the parents, in the case of adolescents especially, to make good decisions to have better outcomes.
That is absolutely true. And I think that part of our responsibility as physicians is that we need to stop drinking the Kool-Aid that we have all the answers, right? Because we don't. So the reality is that, and actually we get trained in medical school to believe that we cure stuff, right? And I have to tell, my father was a physician. He's deceased now. And I know that Vince has heard this before. And he told me once when I was in medical school, he said, listen, son, in medicine, if you don't kill it with an antibiotic or remove it by surgery, we do not cure anything. We treat a lot of things, but we don't cure anything. And that is actually true today, right? So the best we can do is to give you options to decrease intensity of symptoms so you can have a more adaptive and functional life. That is it. and I don't do surgery. So, and I don't give antibiotics very often. So even when I give medications, I have to tell people, listen, at best, medication is going to decrease the intensity of symptoms, but it will teach you nothing. You're not going to learn anything from
That's
taking
right.
a pill. And that's important to keep in mind, though.
So
Yeah,
John,
and I will say,
John,
I would just add. Oh, I'm sorry. Go ahead, Vince.
I was just wondering, in your experience with your kids, how did you manage those options? Did you use medication? Was it group therapy? What roads did you go down with your children and with the along with the advocacy of your wife and taking those options when you applied it to your family?
We really we ran down every road we could, and it grew and morphed and evolved as we went through the kids. We're much better now. I tell my oldest, gosh, I wish I could go back and do over with you because I made all my mistakes with my older kids, and I still made some mistakes with the younger kids too. But we definitely been down the road of medication, and we have done individual group therapy at varying levels in from regular outpatient to intensive inpatient and residential treatment and all those things. We walked down a path after a while that we had a couple of psychiatrists that we didn't feel like were very receptive to maybe making some changes when we weren't having success. Because I always said with my wife takes medication for depression every day, and we've said, look, all that does is unlock doors. It doesn't open the doors and walk through them. You still got to do all the things to be healthy, but it might provide you an open door to decrease the intensity of what you're dealing with, such that you can cope with it successfully.
Exactly.
With my kids in particular have dealt with PTSD from trauma, and we've used medical cannabis. We decided so the straight truth was one of my kids started smoking weed without telling us because they were trying to cope with stuff, and I caught them over Thanksgiving and flipped out, quite frankly, like lost my stuff all over my kids. And she came back to me and was like, Papa, I'm just trying to manage my depression here and manage my symptoms. And I was like, okay, how long have you been doing that? Like 6 weeks. So then I go talk to my wife and I go, have you seen any change in the kid in the last 6 weeks? Yeah, actually I saw a lot of change. All right, if it's helping, we'll go get a card. We'll figure it out. We'll do it. So we did. And in our case, I'm actually, for PTSD patients in particular, I'm a huge proponent of cannabis. And not very many psychiatrists actually have any experience with it and don't want to really touch it, but it's been very effective for my kids. But of course, for adolescents, that's got other problems,
Yeah.
In brain formation. So we've gone down all those paths. And I think that because each kid is so individual and unique, as a parent, you got to be willing to walk that individual and unique path. And when you don't have success with something over time, you got to have the guts to make changes. And I think with kids, especially with mental health care issues, because they're so volatile, especially if you've had attempts at suicide or, danger to self, danger to others, that's become acute, you really become gun shy at making changes because of the volatility of loading and unloading psychiatric medications. But we just were willing to go through it. And that meant a lot of sleepless nights and a lot of give and take and a lot of just prayer that it would work.
Dr. Patino, I have a question for you then. John's case seems so unique, obviously, because it's all of his kids and his wife, but the advocacy. How often do you find patients, parents, or especially of the young kids, being that active in that, or is that a rarity?
Well, it's the exception. It's not the rule. But I think in part we have to be willing to educate and to be inclusive and not to put ourselves in the position of the mental health system versus the parents, right? We get back into the issue of we have to be empathic to the suffering of the parents, their fears, their anger, their frustrations, their culture issues. We always have to recognize those things. And we have to maintain our neutrality. The moment that we lose our cool and we lose our neutrality and we become directive, we lose the parents, right? And the issue is we have to stay focused on the purpose, and the purpose is the child. The parents are a tool, and they have to be feeling the ownership of the kid, right? Because I mean, because of what I deal with, I'm always dealing with the parents being afraid, of stepping in because of the fear of losing their child, right?
Yep.
And that
Very real.
and we have to we have to keep our neutrality, be sensitive, be honest, give them information and allow them to make decisions, not to tell them what they have to do, right?
You
um,
know, we had a moment. I remember very clearly the moment that one of my kids got a new therapist, and an incredible guy. And he talked to my wife and I. He said, I want to just talk to you away from your child a little while and just kind of get your feelings on how things are going and what you're seeing and those things without her in the room so that we can talk. Okay, fine. So we did for about an hour. And he said this thing to me at the end of that. He said, the number one indicator we have of a child making it through issues like this is a warm, stable, loving home environment. If they have a warm, stable, loving home environment, that is the number one indicator that they'll make it through. So I can't make you promises, but I'm very confident here that we're going to make it. And so, and that to me, that poured grace over me. That said, okay, we have the biggest thing, and my responsibility is to maintain a warm, stable, loving home environment for my child.
exactly.
I don't have to fix her. I don't have to stuff her into a little box. I have to maintain a warm, stable, loving home environment. And those words were real fuel for me. So I appreciate what you're doing with that, Doc.
Thank you. Appreciate it. And thank you, John. I think that we're getting to the end of our podcast here. We really appreciate you joining us today. I hope we can do it again sometime in the future. But I think that your words have been very enlightening to us and to the people who are listening to the podcast. Really
I sure
appreciate it.
have enjoyed it. I hope I do get to come on again. I'd love to.
Okay,
John, we hope you get you back on because we have so many things we can talk about. Do really appreciate your time. Try to enjoy the rest of your vacation. I know you took your time out of your vacation to chat with us. And of course, Dr. Patino, as always, thank you for being here and facilitating this. And for the listeners out there, please share, subscribe, and share with us what you want to hear more about. Again, use the comments on YouTube. We have our live comments, but let us know what you want to chat about. John, if you were serious about this, love to have you on again in the near future.
Oh, I'd love to do it. Let's do it.
Fantastic. Thank you very much for your time.
Take care. Bye-bye.